Have you recently noticed changes in someone you love? Maybe they've lost a bit of weight, seem more tired than usual, or aren't quite themselves anymore. It's easy to brush these things off as just old age. But what if I told you they might be something more? You see, when an elderly person is entering their final year of life, the body often sends quiet, subtle signals months in advance. Not dramatic, not alarming, but easy to miss until it's too late. And by then, we've lost the chance to prepare, the chance to say what matters, the chance to give comfort in the ways they need it most. In this video, I want to gently walk you through 5 early warning signs that a loved one may be entering their final stage of life. These are not meant to scare you, but to give you the awareness and tools to respond with compassion, care, and clarity. Because knowing what to look for doesn't just help you prepare for the goodbye. It helps you make every day leading up to it more meaningful. So stay with me. This might be one of the most important videos you ever watch. Sign number 1, unexplained weight loss. Imagine this. You're helping your father into his sweater when you realize it's suddenly much too loose. Or maybe your mother mentions that her favorite pants are falling off, even though she's eating just fine. It's subtle. It's easy to miss. But over time, it becomes undeniable. Unintentional weight loss is one of the most telling and often misunderstood signs that an elderly person may be approaching the final chapter of life. Now let's be clear, not all weight loss is alarming, but when it happens without trying, when your loved one is eating less, or when meals start getting skipped because food just doesn't taste good anymore, it's time to pay attention. As the body begins to slow down in its final year, several changes start to occur beneath the surface. The digestive system becomes less efficient, making it harder to absorb nutrients even when eating normally. Muscle mass declines quickly, weakening strength, balance, and immune defenses. The brain stops sending hunger cues as frequently because it knows, on some deep cellular level, that the body is conserving energy. Chronic illnesses like heart failure, cancer, or kidney disease, often undiagnosed, can accelerate this process quietly. You might be tempted to respond with more food, protein shakes, or calorie-dense snacks. And while those things can help, they may not stop the decline. That's because, at this stage, the issue isn't just nutrition. It's a signal that the body is preparing for a deeper transition. So what can you do? Prioritize comfort over calories. Serve soft, easy-to-chew, high-protein foods that your loved one still enjoys, even if in small amounts. Offer smaller meals more frequently instead of 3 large ones. Think of it like gentle nourishment, not force-feeding. Focus on hydration. Older adults often lose their thirst reflex, and dehydration can worsen fatigue and confusion. And most importantly, don't pressure them to eat. Instead, create a peaceful, loving mealtime environment. Your calm presence matters more than the number of bites they take. Sometimes, what the body needs most in this stage isn't more food, but more dignity, love, and presence. So if you've noticed your loved one quietly shrinking, don't ignore it. It's not just about numbers on the scale. It's about understanding what their body is telling you and responding with care. In the next section, we'll talk about another warning sign that often shows up hand in hand with weight loss, and that's deep, unshakable fatigue. Let's continue. Sign number 2, deep, persistent fatigue that doesn't go away. Picture this. Your mother, who used to enjoy tending to her garden every morning, now struggles just to make it to the porch. Or maybe your grandfather, once proud of his independence, suddenly needs help getting out of bed. Not just once, but every day. You might think, well, that's just old age catching up. But here's the truth. This kind of exhaustion isn't normal aging. It's something more. This is a kind of fatigue that rest doesn't fix. It's not the usual tired after a long day feeling. It's a bone-deep weariness that makes even simple tasks feel overwhelming. Getting dressed, walking across a room, or even having a short conversation becomes too much. So what's really happening? In the final year of life, the body starts to conserve energy for only its most essential functions. Here's what's going on beneath the surface. The heart starts to pump less efficiently, reducing oxygen and blood flow to the muscles. Metabolism slows down, so the body isn't producing or using energy the same way. Muscles begin to weaken rapidly, especially when combined with weight loss, making everything feel heavier and harder. All of this leads to a slow, steady pull towards stillness. You may also notice your loved one sleeping longer during the day, struggling to stay awake during meals or TV shows they used to enjoy, avoiding conversations, not because they don't care, but because they simply don't have the energy. And here's where it gets even more emotional. This fatigue often leads to frustration, embarrassment, or even shame. A proud, independent person may feel like they're becoming a burden. They might withdraw, stop asking for help, or even pretend they're just fine to avoid worrying you. So what can you do? Honor their energy. Don't push or insist they stay active. Instead, focus on helping them feel safe, supported, and unjudged. Adjust daily routines to meet their new pace. That might mean bathing less often, preparing simpler meals, or just letting them nap when they need to. Cherish the moments when they're most alert. Have that short conversation. Hold their hand. Sit quietly beside them. These may become your most treasured memories. This deep fatigue isn't laziness. It's not depression. It's the body's quiet way of saying, I'm preparing. And when you recognize that truth, you stop trying to fix them and start simply being there for them. Next, we'll explore a change that's harder to see, but just as important. Subtle shifts in memory, awareness, and connection. Let's move on to sign number 3, cognitive confusion and emotional withdrawal. Sign number 3, cognitive confusion and emotional withdrawal. Imagine walking into your loved one's room and seeing them stare blankly at the wall. You ask how they're doing, but they seem distant. Maybe they struggle to answer, forget your name, or seem unsure what day it is. If this is someone who used to light up when you visited, who could recall old stories with perfect detail, it can be deeply unsettling. But here's the gentle truth. This mental fog might not just be forgetfulness. It could be a signal that the mind is slowing down, because the body is too. In the final stage of life, the brain often begins to shut down gradually, just like other organs. And it does so in subtle ways at first. Forgetting recent conversations or names, struggling to follow simple instructions or complete a thought, getting confused in familiar places, like mistaking the bathroom for the kitchen, saying things that don't quite make sense, or repeating the same question over and over. You may also notice emotional withdrawal. Someone who was once social and chatty now prefers to sit quietly, speaks less, or avoids interaction altogether. And it's not because they don't love you anymore. It's because their mind is retreating inward, conserving energy and processing less from the outside world. Loud environments may feel overwhelming. Simple conversations may feel like too much work. The emotional centers of the brain become less responsive, and the person may seem emotionally flat or even detached. You might hear things like, "I just want to be alone," "I'm tired of talking," or silence when there used to be stories. What's most heartbreaking is that this change can feel like losing them twice, once emotionally and later physically. But here's how you can respond with love. Don't try to pull them back into conversations. Instead, meet them where they are. Sit beside them. Offer your presence more than your words. Speak slowly and gently. Sometimes a calm voice and eye contact are all they need to feel safe. Use touch. A hand on their shoulder or holding their hand can say more than any sentence. And perhaps most importantly, don't take their distance personally. This isn't rejection. It's not confusion about your value. It's simply the mind preparing for something deeper, something we can't always understand. If you notice your loved one growing more confused, forgetful, or emotionally distant, recognize it as the body and brain entering a quieter, final chapter. Up next, we'll look at another physical clue, one that shows up not in the mind or the mood, but in how the body handles illness and injury. Let's move on to sign number 4, frequent infections and slow healing. Sign number 4, frequent infections and slow healing. Imagine this. Your elderly loved one catches a cold. You expect it to pass in a few days, just like it always has. But this time, it lingers. They stay in bed longer. The cough gets worse. And even after antibiotics, they still seem tired, weak, not quite themselves. Or maybe you notice a small scratch on their arm, but weeks later, it's still not healed. If this sounds familiar, it may not be just getting older. It could be one of the body's final warning signs. As we approach the last stage of life, the immune system, the body's natural defense, is no longer as strong. It doesn't fight off germs the way it used to. Cuts take longer to close. Infections show up more often, and they stick around longer than they should. You might see recurring urinary tract infections, UTIs, repeated chest infections or pneumonia, slow healing wounds or pressure sores, fever that doesn't spike but lingers at low levels, or perhaps most confusing of all, sudden confusion or drowsiness, which in older adults can be the first sign of infection. These are not random. They are signs that the body's energy is being redirected away from healing and toward preservation. As the body prepares to wind down, even small illnesses can become overwhelming. A simple cold can turn into weeks of exhaustion. A sore that once healed in days now lingers for months. And unfortunately, antibiotics often don't work as well anymore. The body becomes less responsive to treatment, and each illness takes a bigger toll. So what can you do when you notice this happening? Shift from curing to comforting. When infections become frequent, aggressive treatments may no longer be helpful, or may even create more stress. Focus instead on making your loved one comfortable. Hydration and gentle nourishment. Even if they aren't eating much, small sips of water and soft, easy-to-digest foods can keep them from feeling worse. Keep the environment clean and calm. Good hygiene, soft bedding, and a peaceful room go a long way. Recognize infections early. Look for unusual tiredness, confusion, or loss of appetite. These might be infection symptoms, even without a fever. What matters most during this time isn't fighting every single illness. It's protecting your loved one's dignity, minimizing pain, and ensuring they feel safe, seen, and loved. If you're noticing frequent sickness or slow healing, your loved one's body may be quietly signaling that it's preparing for its final journey. And that brings us to one of the most visible, and often the most emotional, signs that the end may be near: changes in breathing and circulation. Let's talk about that in sign number 5. A gentle goodbye begins with awareness. If you've made it this far, I want to thank you. Because watching a video like this isn't easy. It takes courage to face what many of us spend our whole lives trying to avoid: the quiet truth that one day, someone we love may not be here anymore. But knowledge is not about fear. It's about preparation, presence, peace. Let's take a moment to remember the 5 signs we've discussed. Significant weight loss, when the body begins to stop absorbing and using nourishment. Extreme fatigue, when even small tasks become overwhelming. Cognitive confusion and withdrawal, when the mind slowly retreats inward. Frequent infections and slow healing, when the immune system starts to shut down. Changes in breathing and circulation, when the heart and lungs begin their final slowing. Individually, these signs may seem small. Together, they tell a powerful story. The body is preparing for its final transition. And while we can't change the outcome, we can change how we show up during this time. We can shift from fixing to comforting, from rushing to slowing down, from holding on in fear to letting go with love. This is your opportunity to sit beside them with no agenda, to whisper old memories, to hold their hand a little longer, to say the things that were never said. Because the end of life doesn't have to be filled with regret and confusion. It can be filled with grace, dignity, and presence, if we're willing to recognize the signs and walk with them, heart open, every step of the way. So if someone you love is showing these signs, take a deep breath. Let go of the need to do more, and just be there. In the silence, in the stillness, in the love that only family can offer. You don't need to be perfect. You just need to be present. Thank you for watching. If this video gave you clarity or comfort, please leave a comment below. What's one thing you've learned today? And how will it change the way you care for someone you love? Your story may be the light someone else needs right now. Until next time, take care. And remember, you are not alone.